September 9th emergency meeting for the Town of Littleton Board of Health. In attendance today are Matt Wason, Kevin Davis, Dan Kane, Kevin Baker, and Francis Daigle, as well as other individuals. We are meeting today on an emergency notice to discuss arbovirus, specifically EEE results for Littleton and our surrounding communities. So to dive right in, I'm going to hand it off to Francis to bring us up to speed on where we are right now.
Thank you. So on September 5th, we were notified of a confirmed positive EEE case in the town of Acton. We were also subsequently notified on the same day that we would be elevated from a risk level of EEE from low to high. In response to this, we contacted the Central Mosquito Control and requested spraying as soon as possible. They were able to come right out and spray on Friday night from 7:30 to midnight across the town. Here today, we have Frank Cornyn from their office who can speak on the spraying more and the efforts that we should continue and preventative measures we might want to consider going forward.
Yeah, so as Francis stated, we were able to come out the next night on September 6th, do the whole town. We had several trucks in the area to get it done as soon as possible because especially this time of year, the evening temperatures can prevent us from making an application. So a lot of times we have a short evening window to get it in. Once the temperatures get below 55 degrees, the application is a lot less effective. So really, we were trying to get it in before that happens this time of year. But yeah, it was very successful Friday night. And we were able to do pretty much all the streets in town, except for a couple down in the southeast area of Fort Pond, particularly Shagbark Drive, Sarah Indian Way, and Countryside Road. But those streets we could come back and do the next time we're in town. As far as protection measures going forward, of course, until the season concludes, so really until the first hard frost, you're going to be wearing long sleeves, long pants, using those insect repellents as well, and avoiding mosquito bites whenever possible. So dusk and dawn, that's when the mosquitoes are most active, and that's when you're going to actively try to avoid those mosquito bites.
Frank.
Yep.
Could you repeat those roads that were not able to be done? Sorry.
Shagbark Drive, Sarah Indian Way, and Countryside Road. I think a lot of those you have to briefly exit town and then drive back into town to get to them. But again, we can get to those the next time we're in town.
In terms of a street that might not be able to be sprayed, either one of these, or maybe if a citizen has requested not to be in the spray zone, do you have any recommendations for a situation where a neighbor would want to take preventative measures on their property specifically?
I don't have any specifics as far as outside applicators and private applicators and things like that. With the exclusion process, we do have to keep a 300-foot buffer between our trucks and those properties, and it's of course parcel based. So you could have a large parcel, and that 300-foot buffer is going to extend beyond that. So in some cases a parcel can impact a couple different roads at the same time. But yeah, for those individuals next to an exclusion zone, keep doing those personal protection measures. And at this point of the year, with the temperatures dropping, mosquito development is slow. There's not as much egg laying going on, so you can always remove standing water, but at this point of the year, it's slowing down anyways.
So just for the general public to understand better, could you kind of explain what the application process entailed and what it does in terms of application and potentially what we should look at in the future going forward now?
Sure. So the application on Friday night?
Yes, please.
So yeah, we got the, we set up maps for the town. All of our maps, have those exclusion parcels on them. Each one of our applicators in their truck have a tablet that has the maps on it with the parcels. And it's actually, GPS based as well. So when they get close to that 300-foot buffer around those exclusion zones, they get a visual warning on their tablet as well as an audio warning as well. And that's really benefits our applicators to make sure that they're not making applications near those exclusion zones. So last Friday, we loaded up the maps and the tablets for all of our applicators. We made sure any new exclusion areas that came in were updated as well. Went out and at dusk started making the application, finished up as quickly as we could before those temperatures got any lower. And yeah, it was very successful. But that type of application is a ULV application. So it uses a product that breaks down very rapidly. It will knock down the mosquitoes that are flying at that time. It's not a barrier application, which some of you might be familiar with, where the foliage on like a lawn or a landscape or a field is treated with a residual product that's going to last for several weeks. This is a quick knockdown to reduce risk as quick as possible. And again, it's not residual, it doesn't remain in the environment. But because it only knocks down those mosquitoes that are actively flying, that is why that temperature restriction is so important, because once you get below 55 or even lower in the 50s, mosquitoes just are not actively flying at that time.
Thank you, Frank.
Yep.
Just out of curiosity, in your ongoing discussions with boards of health who have reached a high level threat for EEE or West Nile virus, is there any common recommendations that you've provided to the boards to consider generally?
Yeah, usually when there's virus found or human positive, we're reaching out to the boards of health, seeing what they want to do. And we're pretty much, we're willing to work with the boards of health and do really whatever they feel like their communities need. We're going to be in the town of Acton tonight, doing a similar operation to what we did in Littleton. So yeah, whatever the town wants or needs us to do, we're there to do it. The only restrictions, of course, this time of year are those temperatures.
Sure. Thank you, Frank. I appreciate all your efforts in answering all these questions. If it's okay, I'd like to open it up to the board to ask any questions they might have to you.
Sure.
Questions? Kevin Davis?
Hi there. Thank you again so much for coming to the town so quickly to go and spray. Real quick question, a couple of questions. One, do you think we need to reapply again in the next coming weeks? Just to, see, like you said, you just knocked down those mosquitoes. We're supposed to get some rain in the middle of the week. And we also had some overnight Saturday night. So I'm assuming if there's larvae or whatever out there, the eggs might start to hatch. And then another week or so from now, the temperatures overnight increase, which they're supposed to do. Is there a chance that we need to have yet another application, say in another week or so? I have one more follow-up.
Sure. With the evening temperatures and I'm not sure up in Littleton, but at our weather station here at the office, we got very minimal rain. And, again, the development really, really slows down this time of year. So unless we got significant, like if a hurricane came through and dumped a couple inches and we got a real flood, which would create, a big hatch, I could see that being an issue. But minor rain this time of year combined with the temperatures, I don't think there would be a lot of extra mosquito emergence going on at this time. So we do have traps in town, every week collecting mosquitoes. So we're going to keep testing. We're going to keep looking at those numbers. If there is a spike in mosquito numbers, we could certainly look to possibly come out again if the weather cooperates. But I couldn't really say, definitive right now.
And that's a great lead into my follow-on question, which is how are the Sentinel stations looking for numbers, and are they rising? What's the data showing us as far as numbers, as far as mosquitoes infected with Triple E or West Nile?
So the numbers have been steadily decreasing for the past couple weeks. There's a big mosquito species that comes out early in, let's say early in July, and that is the most abundant mosquito species we have in the state, or at least in central Massachusetts. But the fortunate thing about that species is it's a single generation species. So it comes out very heavy in late June, early July, and then it just slowly peters off as the season goes along. So when we get to this point of the season, those numbers, which were in the thousands back in July, there are single digits right now, and we're not going to get any new emergence because, again, they are a single generation species. So the species that we'd be looking at right now are those floodwater species, but again, we haven't really had any flooding rains right now. So unless we get a big event like that, the numbers should continue to peter off as we go towards October.
Thank you.
Yep.
Dan Kane, questions?
Kevin got most of mine. I think my only other questions were around standing water. Obviously, getting rid of standing water is a big one. Any recommendations for water that's like immovable? So the kind of water features, small fish ponds, those kind of like thing, or water barrels that hopefully are relatively covered and limited access, but those kind of water containers that you don't really just want to just empty or can't empty. Any recommendations on how to manage that for folks?
I mean, hopefully those rain barrel water barrels, hopefully they have some sort of screen on them so they can get the water in, but mosquitoes can't lay eggs. A fish pond, if there's actually fish in there, you're not going to have a larvae problem. But with the temperatures right now, again, there's not a lot of development going on, unfortunately, for us. But it's one of those situations where at this time of year, the mosquito numbers go down, but the virus potential is almost the highest because we're late in the season. It's had time to build up. So the population's low, but the virus levels tend to be higher. So risk really isn't eliminated until you get that hard frost.
All right, no, great, thank you.
Yep.
Kevin Baker, anything?
I was just curious, as it's going to get warmer, the rest of this week and into next weekend, and I don't think the lows are going to drop below, 55 starting Friday. Does that mean the population may increase a little bit as well as the risk increasing, or is the population pretty much going to be stable now that it's sort of reached those lows at night?
Yeah, I think the population should be, relatively stable. The traps might show a little bump because of that slight increase in temperature, but the actual population out there is consistent.
Thank you.
Yep.
Frank, just thinking proactively, let's say that we do happen to reach a level of critical in this area. What kind of response should we be preparing for that type of instance?
So if Littleton did reach critical, one thing would definitely be to look at the schools, trying to get those treated. We would maybe be able to go out and do a barrier treatment, which is, again, I think I mentioned it earlier, but treating the edges of, fields, wooded fields, shrubs, things like that. Those applications are residual, so they will, create that barrier effect to prevent mosquitoes from coming into the field. And that type of application isn't as dependent on the active mosquitoes, so it's not as impacted by lower evening temperatures as well. So that's something that we could do and would, last several weeks, hopefully into, October. So if Littleton went critical, I would certainly recommend that, as well as a ULV application if the temperature is allowed, just to knock down anything actively in the area. And if it did go critical as well, we could look at, doing the town again as well. So we would just have to look at all the other factors that go along with that.
Frank, thank you so much for all the information answering these questions. You mentioned the schools as a part of critical. I think this could be a good segue into asking a little bit more about the schools. We have a lot of people in attendance, including Dr. Clenchy, who's our school superintendent. So give us a little information between Frank and Francis. What's the status of the schools and recommendations? Obviously, they're not necessarily right on streets, but there was some spraying done nearby the properties at least Friday. So what else is there about the schools you can tell us?
So the schools, any kind of application done on the schools falls under the Children's Protection Act, which involves a lot of notification procedures. Typically, parents have to be notified 48 hours in advance of an application. This can be, you can do an application sooner, but it has to be done under an emergency waiver, which has to be signed by the health department in town. So typically, what'll happen when we do schools is we send them the labels of the products, a written notification form, a couple other forms that then schools will typically post on their website. And then after posting on their website, they'll send out a communication to parents saying, we're going to do mosquito spraying the next night, the night after. Look to our website for all the other information. And that's where the parents can access all those forms and labels. So that has to be done, and then we can go in and do the application. So if it's under an emergency waiver and you're making that application before 48 hours notification, you still have to do all those notifications even though you're making it under an emergency waiver. The property gets posted, and then those postings, those physical postings on the property have to stay up for 72 hours post application. So those are all different components to go with the Children's Protection Act and making an application on school property.
Thank you. Did anybody else have a follow-up question on schools? Dan?
So I'm just trying to do our overlays here. So we did street coverage Friday night, which is awesome. Schools kind of under a different set of rules. So I'm trying to figure out, so let's say we'll pick the high school only because it's a relatively good distance from most of our streets for a big hunk of the property. Same for Russell Street and the middle school somewhat. How much coverage was there, since I don't think we usually get the reverse 911 for those regular sprays for their fields. Are those areas really limited or no coverage because they're further away from streets and they require that different notification process, so they really weren't specifically addressed? I'm just trying to see how the maps overlay and what kind of coverage we had for the population centers.
Yeah, so I'm looking at some of the maps right now, and in the situation of those schools, I think we remained on the main roads. We didn't go into the parking lots of the schools or any of the other school grounds. So we have done the Littleton schools in the past, and we worked with an IPM coordinator, Stephen Mark, and he actually we reviewed the IPM programs for the high school, middle school, Shaker Lane School, and Russell Street School, and they were all up to date with the products that we use, which is great. So it's one less thing that has to be done.
Great, thank you.
Yep.
Tim raised his hand. He's now in here, so go ahead, Tim.
Hi, everybody. Alicia and I just wanted to give a quick update to everyone. So we work closely with these guys and have been doing all the parks and all the park and rec sites in the entirety of the summer, as we always do. Just as recently as last week, we were working with Steve Mark to update all of the spraying for the sports fields. Obviously, we oversee the Youth Sports Council, and we're in communication with all of the sports organizations. So that was something that Steve had reached out to us to see how we get the ball rolling on that, to the point that Frank just made. So we can also pass along all those emails if anybody's interested. But that the ball and getting all the sports fields treated started getting pushed forward. It was last Monday into Tuesday. So that process is already well on the way. Do you have anything to add?
Nope, that's right on. Yep.
Can you give a little more in the process as well on the way? What is the process and when is the way?
I'm just searching for my email right now just to kind of see where we were at. I was out at the end of the week. Sorry.
Yeah, because there's special rules for the school, they have to be able to post. So I know Tim, is it McGlinchey? McGlinchey. I always forget the L. So he had sent over the information on all of the chemicals that they would be using because that's got to be posted. So I know he was working with Steve to try to get that all set. Kevin.
So when is the application actually going to happen? When is that coordinated event going to happen? So that way, because that's
Kelly would probably have a better information on that than we would.
Kelly, you're on mute.
Sorry, I was on the phone with Steve Mark.
Oh.
Go ahead. Did you have a question for me, or?
When?
Yeah.
The question is when? When are the fields going to be sprayed? What's the timeline, do we think?
He's contacting the state today, so hopefully if they can accommodate us within that 48-hour time window, it should be in 48 hours.
okay.
Yeah, last Tuesday we had received all the information on what the necessary postings and everything else were that I had forwarded over to Steve Mark.
Yeah.
And then he was taking the initiative on that. The parks, Fay Park, Castle in the Trees, Long Lake Park. Did we do it?
Well, they did a whole town wide. I think Frank was talking about that. So they had done a more recent one. But the parks were done the week before. Yeah.
Yep.
And then what about the soccer fields that we lease or utilize behind St. Anne's Church? Because that's right next to a set of wetlands.
Right. So currently this season, we're not utilizing that property.
Okay.
Plan that we put in place to try to, we're doing a pilot program that goes with a different project, but we consolidated all of the sports field usages this season in order to rest a couple fields. In doing
Yep.
so, we're able to move the little kids over. So we're not utilizing that right now. Depending on how it goes, we might send them back there in the spring. But I've already advised all these sports organizations that I sent out an email just letting them know. And I'll do a follow-up email based off of what the recommendation, if it changes at the end of this conversation on what it is. But they're currently not utilizing that space. I told them that was one of the spaces that hadn't been treated. And, based off of that, we need to figure out, if they are going to be off the fields by 6 o'clock every day. Because just so everyone in here does know, with the school time getting pushed back, the 6 o'clock ending time would allow only a half an hour for all of our youth sports organizations in the town of Littleton to conduct practices and games on weeknights.
Thank you for that, Tim. And Dr. Clenchey, were there any other details that you wanted to offer since we have you here?
Well, we're certainly anxious in getting our fields sprayed, so the sooner the better. A question I do have, if they are sprayed with the barrier spray, does that suffice in terms of creating a safer environment to allow sports to go on during the evening?
I guess I can send that question to Frank first.
Okay.
Okay, yeah, I mean, when we make that barrier application, we should be, it should be creating basically a perimeter barrier, if you will, to prevent mosquitoes from coming in, to the playing fields. It does last a couple of weeks, depending on rain that you get. But again, these are all tools to reduce risk, but it's not going to eliminate risk. So that's just something to keep in mind.
That's very helpful. I mean, from my point of view, we need to do everything we can to keep our students and community safe. So if we have to impose a rule where there's no playing after dusk or a half hour before dusk. That's up to the health board, but I would certainly be in favor of that if it's necessary at this point in time.
Thank you for that. I think that probably covers our active response in terms of spraying and the coverage areas that we have. Is that the case, Francis, or anything else on that topic?
I have nothing further.
Okay. In that case, Francis, can you kind of give us the rest of the basically recommendations from DPH and from yourself as to what we should do beyond just our spraying treatments?
Absolutely. Our town administrator has his hand up though, if you want to go to him first.
Oh, sorry. Go ahead, Jim.
No problem. Thank you very much. So this is a couple of questions. The first one, Frank, couple of calls that have come into, sorry, I'll take down my hand. Couple of questions that have come into the office has been the effects that the spraying had the other night on domestic pets that were outside or people's windows that were open or anything like that. What can I tell individuals?
So this, the product we use is called Zenovex. It is a synthetic pyrethroid. The active ingredient is etofenprox. It has very low mammalian toxicity. Synthetic pyrethroids are used in flea collars for pets. It's actually the EPA categorizes it as a reduced risk pesticide, I believe. There's a lot more information on our website as well. If you want to check that out, I could send that to you actually. But there shouldn't be
Sure. Thank you.
There shouldn't be any significant concerns with incidental exposure.
Okay. And I would pose my next question to the Board of Health, Mr. Chairman. I don't know, if we get to a critical sign or even to moving forward with doing a spraying in the fields and everything like that. Do you have a recommended outreach that you would like to do for the community?
Sorry, was that recommended outreach?
Yeah.
We went with the community-wide alert last Friday about the spraying, which included the information on the personal protection and pets and such. And I believe there was the link that Frank mentioned to their website on the information. Francis can correct me if I'm wrong. But I would pitch that right to Francis first. So what's our communication strategy moving forward? But if I could just pause on that answer then for now and talk about what the other recommended steps are, because I think once we kind of fully understand what the global recommendations are going to be from this board and the department, then I think the next step is, okay, well, how are we now going to make sure everybody's aware of what we're talking about? Is that fair?
Thank you, Mr. Chairman. Sure.
Okay.
Thank you. So I have sent the board, and I apologize for the lateness of it, but it is the MDPH, our revised surveillance and response plan. Inside of this, I have highlighted the guidelines for a phased response to surveillance data. And if we look in that document as a community threat level of high, it has recommendations to intensify public education on personal protection.
Francis?
Yep,
Would you mind sharing your screen so everybody can read along?
sure.
Thank you.
So we'd be looking here. So we'd be looking at public education, multimedia messages, alerts, press releases, regular updates. Maybe we can work with elder services on how to increase communication in certain more vulnerable populations to make sure that the message is widely received. Obviously, we have here an urge to reschedule outdoor events that occur between dusk and dawn. Adult deciding, which we have done this past Friday and which I believe will be conducted through, is it the 25th, Frank?
The adult deciding of the 25th of September.
Yeah.
I mean, we can spray as long as weather conditions allow. So,
Okay.
Um,
And obviously we are actively surveilling cases, so we will be on top of any cases that are confirmed or respect in the general area, and then we will tailor our new message according to what threat level we are at that time. The board have any questions on these recommendations or thoughts?
Any board member questions? Kevin? Dee?
Yeah, just a more of a question. The Parks and Recs folks said that there's only a half an hour between when school lets out and when the soccer clinics and such have the ability to practice on the field. That does not include the high school practice times. Is that correct? That's just the Parks and Rec time.
Yeah, the high school sports have, from the time right after school, middle school sports as well, they vacate the fields at approximately 5 p.m. for all those sports. So it is some park and rec program. We're not really tremendously impacted right now. This is youth sports organizations, lacrosse, soccer, and baseball primarily.
Right. So that's from 5 p.m. to 6 p.m. or whenever dusk is, a half hour before dusk. So that's an hour.
Yes, it's an hour typically by the time the transition happens, and if there's a game, most of those guys don't start till 5:30 because of that reason.
Okay. Dr. Clenchy, the Russell Street Fields, I guess where most of the high school games are and the middle school fields are using those. Is that where most of the fields are for the fall sports that are in use?
With the exception of soccer, soccer is played at the high school field.
Okay. Okay, but it doesn't take all. It's just that one field, the one large field at the high school, not all the other fields that are on the sides.
That's correct. Yeah.
Okay. Okay. Thank you.
Additional board questions on the recommendations? Kevin Baker.
I heard Frank mention protocols and things that the board can do in an instance like this. And I'm wondering if Dr. Clenchy and Tim and Alicia, if we can help you by taking a vote today to get the field sprayed faster so that we don't have to put a curfew up there. If that sort of thing is going to help you guys, let us know your recommendation on how we can help the team here.
I would certainly be in favor of that. Yeah, that would be great if you could do that. The quicker the better. I guess I'm still concerned and maybe overly concerned. The barrier spray I thought would do more than it actually does, but it'll certainly be a huge help.
Correct me if I'm wrong. It sounds like the barrier spray is good, but then once you get the first rain, it's done.
No, it'll last through a couple rains, but
Okay.
If you have persistent rains, it's going to lower the longevity of the treatment. But
And then if we get a flooding rain, like when we get a hurricane that may come through with the Francis that's currently in the Gulf.
Thank you.
Is that the kind of rain that we're looking at? Would if it does hit New England, they don't know where it's going yet. It's more than a week out too. So
yeah, if we got significant rains like that, coupled with elevated temperatures to,
have the hat.
Yeah, get the breeding going and the development. Yeah.
Yeah. So I also wanted to do a clarification real quick. You said that we have decreasing number of mosquitoes right now, but the virus level is increasing. So your odds of actually having a mosquito that is, the potential of having a mosquito bite come from a triple E or the other virus there actually goes up because the number that are there are, lower. Is that correct?
So these viruses they're bird viruses, right? They're harbored and reservoired in the bird population. So the longer the season goes along, the more opportunity mosquitoes get to acquire those diseases from birds.
Got it.
So that's just it's a fact of that, yeah.
Yep, birds and reptiles. Okay, thank you.
Yep.
And just to clarify, it's been brought up a kind of different ways a couple times. The barrier sprays are not perfect. Nothing is perfect. Everything has a lifespan. Everything has a limited amount of effectiveness. And as Frank mentioned earlier, every step is simply a step towards risk reduction. So I personally would not say that it's a one or the other option. I think we're trying to look at a menu of options, all to try to reduce our risk as much as possible. One is spraying to make sure flying mosquitoes are wiped out. One is a barrier application, which again is not perfect and also depends on if your neighbor is doing it and where you're running. And then lastly, as we've mentioned a little bit, the constraints on time and activity. So if you want the lowest risk, then it would be combining all of those things together. And that's what we should be looking at moving forward. So any other questions or clarifications on the recommendations that Francis showed, Kevin Baker?
I'm just looking at the calendar at the end of that attachment, the appendix, for the recommended cancellation times for outdoor activities in areas of high risk. And it looks like, so the recommended time would be for September 11th would be 7 o'clock, and it sort of scales back 15 minutes every week as you get into October. So like October 30th, it's 5:30.
Francis, could you reshare and show that last page and preferably have it turned 90 degrees?
The right way, yeah.
And the other thing I want to throw in there too, real quick, sorry, Mr. Chairman. I looked back on a couple of like the Old Farmer's Almanac and a couple other things. It looks like the first frost, hard frost, comes in like by the second week of October, usually. But who knows what it's going to do now.
I think the recommendation to the board, we do have a meeting coming up in 2 weeks. So whatever we do today, we can review again on the 25th and update recommendations based on climate and mosquito activity.
Francis, you sent a different document that has the 2024 calendar on it.
Oh, I apologize.
Thank you. Yeah, so this is what Kevin was referring to. This is a calendar that comes as well with the recommended steps we should be taking. And this is again, recommended cancellation times for outdoor activities. So if you can see that, this week is September 9th, and the recommended cutoff time would be 7 p.m. based upon this table.
Just to clarify, is that just saying when sunset is, or is that to get off the field time, or is it a half an hour before 7 o'clock?
Dan, can you answer that?
I can't actually, I looked it up. So that 7 p.m. time is 30 minutes prior to sunset. So that 7 p.m. is the 30 minutes prior to dusk number. So since we have it up, that was going to be my piece. I know a number of other communities just use 6 o'clock as just a blanket number, which obviously we want to minimize risk while still allowing as much access as possible for everyone, particularly our students and athletes. But that 7 o'clock number, I think, certainly decreases some of the impact for our teams, both in the schools and in the community, while still providing the recommended level of 30 minutes prior to dusk with a little bit of leeway. If it's 7:05, that's a lot different than it's already past, sunset. So I think certainly as we're looking at our recommendations, I think utilizing this kind of sliding scale based on 30 minutes, dusk minus 30 is probably, while a little bit more complex to message, I think it's probably going to be less impactful and more widely well received than simply 6 o'clock because it's easy. Because I think we can still offer some level of safety and protection, but still have an hour extra access for folks.
Kevin Baker?
7 p.m. would be an excellent time to reapply bug spray if you happen to be outside as well. Just wanted to mention that.
Yeah, and bug spray. So there's also something that we want to make sure that we tell people too, is that the bug spray that people should be using is one of the mentioned bug sprays by the DPH that contains some sort of DEET in it, or there's a couple other things out there. So you don't want to just have something that, kind of works. You want something that really works. So make sure you're applying the correct kind of bug spray, just not something. So something that contains DEET is one of those recommended things.
Thank you, Kevin. I believe that list was also sent out in our communication last Friday. Yes, there's a kind of a list of approved / suggested compounds. DEET is the primary one, but there are a handful of others that they say are effective.
Agreed.
Kevin Baker?
Through the chair, Francis, is there language for a motion that would allow the board to implement the emergency spraying for the barrier, for the fields?
Did not put something specific to Matt, but maybe Frank, would you be able to comment on this?
So we can send over those emergency waivers for the school properties, if that's what you're interested in. Again, if you're going to do it within 48 hours or before the 48-hour notifications, you need that emergency waiver. So if you wanted to do it tomorrow night, Wednesday night, you would definitely need the emergency waiver. Beyond that, we could maybe do it Thursday without the waiver, if everything was really promptly posted. But yeah, certainly tomorrow or Wednesday would certainly need the emergency waiver, which I could send over to Francis soon.
Tim, go ahead.
I was just going to let everybody know, I was just talking to Steve Mark. So we did actually have the posting from last week. It's already prepared. We just didn't get it posted for the 48 hours. The spraying was supposed to take place on the 5th. So that's in hand. If the dates are changed, it could happen on Thursday. We could suspend the youth practices so they could get out there right after high school starts. That's another opportunity that we could have. Just like when we post fertilizer closures, we could close all youth sports for Thursday and get it done. So just wanted to give you guys an update on that. I did just forward to Francis, Jim, and Kelly the email from last week with all of the pesticide information, the letters, and all the waivers that we do have all that stuff in hand, except for the emergency waiver.
Go ahead, Kevin.
I'll make a motion for the Board of Health to sign the emergency waiver so we can get the spraying done at our earliest convenience.
Understanding that the purpose of the existence of the emergency waiver is so that parents and families have time to understand information prior to the spraying. We have a motion.
Before I second, the notification still goes out. It's just not within, it's less than 48 hours. Still notification occurs before spraying. It's just shorter lead time.
Could you pause
Okay.
for a second? Frank raised his hand.
Yeah, I was going to say Dan is correct. So everything that you were going to do without the emergency waiver still has to be done with the emergency waiver. It just allows for a quicker application. And I think that you need an emergency waiver for each location. So I'm not sure which schools we're looking at, if we're looking at all of them or just certain ones. But I think you might need an emergency waiver for each one. It's just another form. But so I don't know if your motion needed to have that in there as well for each school.
I'll amend the motion to include all 4 schools in the Littleton Public School system.
Kevin Davis.
Friendly. Would it possible also to make sure that we include all the whatever Parks and Recs needs for the fields, so that way they get, if they want to get sprayed early as well, or is that outside the bounds of what you were thinking, Kevin?
No, that's totally inside the bounds.
Okay.
Tim, is that something you need as well?
No, we do this continuously, and we're not required because it's basically the state law the school has that requires us to post.
Got it. Okay. Then I withdraw.
I second.
We have a motion and a second. Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Kevin Davis.
Kevin Davis votes yes.
Dan Kane.
Dan Kane votes yes.
Matt Wason votes yes. So we will grant the emergency waiver. Frank, you'll get some language, work with Francis, whatever we need to do. We put the vote here, so if somebody needs to sign something, let me know. Or if it's sufficient for this vote to cover it. Okay, Frank and Francis, we're gonna let us know. Kevin, were you gonna ask something?
Do we need to talk about times, or are the recommended times just the times we're going to recommend? And
so yes, all we did so far is just approve some emergency spraying of the school properties. So now I think we should go back to the full recommendations, which included stuff we're not really having to take an action on, which is continued monitoring and paying attention and communicating to the public, all those key things. So in that document that Francis shared on the basically response for the high level activity, that is where it includes the recommendations on evening restrictions or times. So Francis sent over to me earlier saying, do we just want to, as a board, kind of adopt those recommendations globally? And then I think if so, then we could talk more specifically about what the times, what specific time definition we want to use, because that is not called out specifically in the recommendations. Does that make sense? So is there any other response we want to do as a board besides what was included in that document, which was, again, fundamentally educate the public, utilize messaging, seek out our high-risk populations and make sure we're working closely with them, and urge rescheduling of outdoor and evening events. And then subsequent to that was all of the discontinued surveillance and potential further use of spraying as needed.
So moved.
Dan.
I think including these as our basic is good. Want to make sure we clarify, is this strong recommendation or is this require ending of activity of organized town sponsored or approved activity? I think we're still at the recommend or strongly recommend level, but just make sure we're clear on what our intent is. It talks about public education. I think our website is great, but probably doesn't catch all the folks who it probably should get out to. Do we want to consider reverse 911, which is some basic information and some signage at those big gathering areas? You know, the gates to the school fields, you know, I was gonna say near the playground at Fay Park or the gazebo at Fay Park, castle in the trees, like right there at the entrance. I'm just trying to think of those, you know, for 10 or 12 laminated, you know, quick signs, you know, PowerPoint throw togethers, but at least some quick information reminding long sleeves, bug spray, in before dark, kind of outreach pieces that might catch folks that we might not otherwise catch with a website post or an LCTV post. I think that'd be just how do we want to clarify and how do we want to help either get feedback from Francis in the department or offer some suggestions to make sure that we are catching the most folks as possible.
You get some laminate signs made immediately if the board would want to do that. Also for conservation trails as well.
I think we should also, could we work with the school system and maybe have a flyer or some sort of communication go out to the schools so that the population of the schools are also informed about what's going on, since that'll hit two populations potentially, which is the people are going there at the sports, and then also the youth activities and things like that. Maybe reach out to the youth groups.
Yeah, the principals in their principal, their weekly principal letters, email, send out there an update.
Yeah, we can certainly do that. We can also send a message out to all families as well with a flyer.
So we have a hand raised in the audience.
Thank you, Mr. Chairman. I know that Dan had expressed reverse 911. I just wanted to get the understanding from what's the board's position on that, and if I can also share my perspective on the utilization of reverse 911. But how would you? So, what is the board's perspective, please?
What is our perspective on potentially using it as a tool?
Yes, sir.
I think we're open to it in times when it's deemed necessary. Obviously, it's not something that I would want to be used on a regular basis, but for emergency situations, I think it makes sense. Personally, on this one, I think we've been getting some communication out, and so this isn't a sudden start thing. I think we were going to make a dramatic change to our recommendations, or if we were implementing anything that was mandatory, I think that would probably lend itself more to utilizing a tool such as that. But also happy to hear your opinion on it.
No, I just I think it's almost used as the sacred cow. It's it's a 911 is the universal number as we all know for emergency, and so for us to express that there is an emergency out there, I agree with you. It should be utilized, but if it's I was just trying to get the temperature of the Board of Health on expectations out there, because I have some residents that are expressing to the office that why wasn't reverse 911 issued, and I don't agree with it at this point. That's just my opinion. So, but I will clearly respect the board.
Thank you. Hand there for Kimberly Harriman.
Yes, hi. Actually, to speak to that, because I'm a parent, I did get the information 3 different ways about the all-town spraying the other day. And Jim, I'm sure this is some of what you're hearing, but there were some people that did not know about it, and because they did not have children in the system. And so while and they talked about all the kind of things about, well, they didn't know to keep their door closed, or they have chemical sensitivities, all the things that were mentioned in that email that I got through the schools. And so I understand that reverse 911 does sound like an emergency situation, but it is like there's got to be a way to get town-wide information out to people. And I think that's kind of it. all at once for, for people that not just the people who have students.
Yeah, if I may through the chair, if I can comment to that, Mr. Chairman. I thank you. I respect that, Kimberly, and completely. Some of the people that have expressed that into the office, they only it's a matter of they've chosen not to sign up for specific alerts. There's limited amounts, and there's that ability for them to be alert and get that on their text or their email. So the mechanisms are out there. The platforms are out there before going to 911. There's multiple: Facebook, there's Twitter, there's a town website, there's the community-wide alert, there is things of that. And so I think we have the bases covered with that for people, especially that don't have children in the school system.
Through the chair, just one final thought about that, which is probably a bigger issue, but I only know about the community alerts because someone told me about them, and then I've told other people about them. It is a bigger project, but I think a lot of people don't know about those emails you can get that are specific to each kind of board, each kind of piece of information, things like that. Bigger problem than right now, but I think that it's not that people are choosing not to. I think a lot of people don't know about them.
Fair enough. Thank you.
Thank you very much. It's important to hear that. I know it was briefly discussed on Friday as to whether this was the right time to pull that lever, and I think there wasn't enough consensus. But you're right. I think it's something where on Friday we were going to go out and spray. In hindsight, that may have been a better time to use it. I think that, after today's meeting, I don't see as much of a use for it unless the board were to vote to put in restrictions that were mandatory. Again, something that is very urgent for people to understand. That's either short notice or a requirement. So I think Friday potentially fell under one of those categories. So we should look more closely at that in the future. And it's a good point. Make sure our communication methods are well adopted by our community as much as we can. So thank you for your input. Our recommendations. Further questions about recommendations that we want to put in. Dan, were you done with your questions?
Yeah, I think so. Just that making sure we have that clear conversation with Francis and us of how the intensified public education, what that actually looks like, and how we're going to actually make that happen.
Do we need further discussion, or would somebody like to propose a motion?
I'll make a motion that we, as a board, order the level 4 EEE high level DPH recommendations as our primary interventions at the moment for EEE prevention here in Littleton.
Second that.
We have a motion, a second. Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Kevin Davis.
Kevin Davis votes yes.
Dan Kane.
Dan Kane votes yes.
Matt Wason votes yes. So that covers the general recommendations that we showed earlier for the high level for now. For sure, we have another board meeting on the 25th of September. We're not done. I'm just throwing this out there. That I think would be a good time to revisit. I don't think we're expecting a lot of snow between now and then. So circumstances will likely still be where we are right now, albeit with some other sprays or other treatments or applications that have happened. So I think Francis can handle that for the most part over the next 2.5 weeks, hopefully without board intervention, but we can come together if there's something else urgent. I think the one thing that we've discussed quite a bit is that is not spelled out specifically, and there is the time. So does the board want to further explain or define or make a recommendation, a strong recommendation to community members about our events in the dusk and evening hours? And there was the calendar that was shown. It has some times. Again, it's all risk. So those are estimated times. If it's a cloudy day or a warm day, it might be different. So we can go based upon those times or make a kind of a general time for the next couple of weeks, or lots of options. Dan, did you raise your hand?
I did. I was going to say, I think, again, I agree with you that it's a balancing act. I think utilizing the times listed in the appendix to the DPH recommendations is a fair balance between 30 minutes before dusk, but still maximizing access for our students this early in the year, and maintaining some sense of normalcy despite the high level. I think my piece again is just how do we best message that so that, wait, it was 7:00? No, it's 6:45. What week are we on? That's my only challenge with how do we message that effectively for coaches and program leaders and the schools. I think the school is pretty easy with a limited coaching staff, but some of the sporting or the community organizations may be a little bit harder to get that out. But I think that's a reasonable balance of using that calendar in those times.
Tim.
I was just going to say for Dan, I can get that chart, I will post that to our field status webpage because everybody follows that. There's also the poster that says protect yourself from mosquitoes. We're going to print those out for the parks and put them in the kiosk. We're happy to print out them and post them at all of the school fields as well. So we can work in concert with Francis on anything that needs to be printed and laminated up here at Park and Rec. Happy to help with that. But I will, based off of your advisement, we'll put all of that on the field status, and we can refer people to that page as well. We do update that every day based on weather, so the youth sports know what's going on. We can also add the EEE link to Massachusetts Public Health, so people can click on that and advise themselves. I'll put that up on that page as one of the quick links.
Tim, thank you for offering all that. That would be very helpful. We'll also keep in mind that what we're about to talk about is beyond just youth sports. So this board is considering making a strong recommendation for activities in the evening. So keep that in your mind as discussion continues. Kevin Davis, did you raise your hand?
Yeah, but you said it. All good.
Okay. Kevin Baker, any input? I'll just throw out the opposite of saying we could go by a weekly schedule as shown in that appendix 2, which would be 7 p.m. this week, 6:45 the following, 6:30 after. Or we could also consider saying it's 6:30. If you said 6:30 p.m. right now, that would cover it from now and through the first week of October, where we could then kind of, again, at our next meeting, consider making a change. So I also want to make sure we're balancing something that's that easy message for our community. So if we said 6:30, it would cover the rest of the month and get us into October. And so I'd like that to be considered. There is another hand raised. Brad Lang.
Hi, can you hear me?
State your name and address for the record.
Can you hear me now?
Yes.
Hi, Brad Lang, 76 New Estate Road. I am actually with the soccer board. Just to give you guys a heads up, like that timetable that you guys just posted works very well for us. I know safety concerns, obviously, with this whole thing. But that timetable we can make that fit for players, parents, and coaches. Also, we have access to every single person who signed up in our program, as well as the other sports do. So emailing that out weekly as a reminder, we have to be off at this time is not an issue. So we can also assist with that.
Thank you, Brad.
Yep, that's all I wanted to tell you.
Cool. Kevin Davis.
Real quick on that, if you could also add, and this is what I remembered, if you could also add the recommended treatments for bug spray as you're applying that to your to the people in town as part of that would be really helpful as well. So that way we can have a consolidated, this is what you should be applying, like the recommended anti-mosquito applications.
I'll piggyback on that. Maybe one of the things to do is, Francis, if we could just make sure we have a single web page with all the right stuff. And that way, everybody that's sending a communication now can be including a link to that exact same page. That way we know that everybody's getting full, complete, same information. No mistakes or no misses on any of them.
I'll make a surveillance page.
Thank you.
Thank you.
Any further questions or comments on activity levels and guidance? Would the board like to entertain a motion about a strong recommendation or the like? Kevin Baker.
I'd like to make a motion to adopt the recommended times from the DPH as noted in the appendix. Or the
I can ask for
recommended
clarification. Adopting those times to what end?
To as the schedule for activity to end on fields recommended.
I would like, can I have a friendly amendment to that?
Perhaps. Go ahead. Go ahead. We'll see if Mr. Baker would like your amendment.
To the first hard frost.
Until the first hard frost.
For clarification purposes, Frank, is that the general recommendation? Is first hard frost is when we can take our foot off the gas?
Yeah, that's what we do say. So the risk isn't eliminated until then. So
Okay. Thank you for that clarification. In that case, we have a motion on the floor.
Second it.
And that's a second. Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Kevin Davis.
Kevin Davis votes yes.
Dan Kane.
Dan Kane votes yes.
Matt Wason votes yes. So we have adopted the recommendation that evening activities are wrapped up by a certain time each week as identified in Appendix 2 of the DPH recommendations. And I now hand it all off to you to communicate out to our community members a lot.
Thank you.
Chair.
Yeah, yes, Kevin Baker.
Motion to adjourn.
Good. No second on that right away. So if I could just have a couple more minutes first, is there any area of this whole issue, arbovirus, EEE, thank goodness not West Nile virus for us right now, that anybody has a further concern about that has not been covered that they would like this board to discuss and potentially provide any assistance in? Either in our meeting or any other attendee.
No, thank you, sir.
Okay. Dan Kane?
I'm not sure if we need to send out communication to school department or DPW or some of our town agencies looking for things like standing water and some of those pieces where, you know, residences we can't really control too much, but certainly for our public properties, there's places that I'm sure they've already handled and addressed this, but can we just touch base with our school staff, our DPW staff, transfer station, those kind of places where there might be opportunities to just do a quick walkthrough and go, let's see other places we can minimize some risk. I'm not sure if that's necessary or if it's not already I'm sure it's already being done. I'm not sure if we need to message it, but just as part of that communication effort.
So we began internally messaging on Friday. We'll increase that messaging and get guidance materials out that can be widely distributed.
Mr. Chair.
Yes, go ahead.
Maybe even reaching out to our Littleton Electric and Littleton Water Department to make sure that they are also listening to some of these recommendations. And as they go about the town looking for things that they can also possibly help with some of that standing water elimination as well.
Of course.
All right. If there's nothing further, the last thing I want to mention, hand raise. Tim, unmute.
You can also ask Light and Water to put on the back of their bills. That might be a really great way to reach out to everybody.
Good idea.
Thank you.
Last, I just want to throw out that EEE, it's been a long meeting, and thank you for people who are paying attention, listening. Eastern equine encephalitis is a viral-borne illness. As it was mentioned, it's in birds, but mosquitoes then traffic it from birds to humans. And so if you get symptoms, and those symptoms can just be a fever, some aches and pains, go ahead and take care of yourself. Go see the doctor. There are some more serious symptoms that are out there that could be nausea, vomiting, or mental status changes. Those are more concerning, that you definitely want to be seen by a physician. You can contract the illness and never have any symptoms, and it's okay. So this can be a bad disease, but it doesn't necessarily have to be. But as a part of this, please keep track of things. I believe the incubation is about a week, so 4 to 10 days. So if you do get a mosquito bite, you're not going to be sick the next morning. That's not it. So it's about approximately a week after that you can start to see some symptoms. So keep an eye on yourself, take care of yourself, take care of your family members, take care of your community members. And that's all I wanted to add. Anything further?
Mr. Chairman, if I have one thing, I just wanted to say, Francis has done a very, very good job with communicating, keeping people, the administration involved and informed of everything, and has done a great job. And just so everyone knows, we had a department head meeting this morning, and Francis gave a detailed overview of what the town and what the town is addressing, how it's been addressed, and anything going forward. So it's covered through all the department heads. He did a great job. But thank you.
Thank you very much for that, Jim. And it is great to have a health director. Thank you, Francis.
Message received.
Kevin Baker, anything to say?
Sir. Motion's still on the floor.
We still have a motion. There is a motion to adjourn on the floor.
Second the motion.
There is a second. Roll call vote. Kevin Davis.
Kevin Davis votes yes.
Kevin Baker.
Kevin Baker votes yes. Thank you.
Dan King.
Dan Kane votes yes.
Matt Wason votes yes. Thank you all for your participation. Thank you for being here on short notice on a Monday afternoon. Appreciate it.
Thank you, guys.
Thanks everybody for all your work.
Thank you, Frank.